An AI model just solved 18 medical cases that human specialists couldn't, not in a benchmark, in published clinical data from NEJM AI. OpenAI and Boston Children's Hospital released findings last week. O3 Deep Research reviewed 376 pediatric genetic cases and assisted in diagnosing 18 that had no prior diagnosis. One patient, Kyra, had been searching for answers since age 9. She got her diagnosis at 28. That's not a marketing claim. That's a peer-reviewed study in the New England Journal of Medicine AI section. Here's what happened. Boston Children's Hospital assembled cases of children with suspected genetic disorders where standard workup failed. They fed clinical data, genetic sequences, and medical histories into O3 Deep Research. The model produced diagnostic hypotheses. Specialists reviewed them. 18 cases yielded new, clinically validated diagnoses. 14% solve rate on unsolved cases, in a domain where human experts already failed. Why this matters right now. Medical AI has been all talk for a decade. Vendor demos, academic papers that don't replicate, regulatory theater. This is different. It's published, peer-reviewed, and involves a real hospital making real clinical decisions on real patients. For builders working in healthcare automation, this proves the specific conditions where narrow AI adds value, high information density domains where pattern recognition compounds human expertise rather than replacing it. Genetic diagnosis is constrained, well-defined, and failure-sensitive, perfect for deep reasoning models. This isn't general medical AI. It's not replacing doctors. It's augmenting the diagnostic process at the exact bottleneck where human specialists hit a wall. The timing signals something else. Dean Ball, the White House AI advisor who drafted America's AI Action Plan, joins OpenAI July 6th as head of strategic futures. Noam Shazeer, the Transformer co-author who led Gemini at Google, just left to lead architecture research at OpenAI. Google paid $2.7 billion to rehire him 18 months ago. OpenAI is consolidating both technical depth and political architecture. Medical applications demand both. What to watch? Replication is the first signal. Did Boston Children's Hospital reproduce this independently, or was this a one-time collaboration? Second, does O3 generalize beyond genetic diagnostics into radiology, pathology, or clinical decision support? Third, what's the regulatory pathway? FDA, breakthrough designation, clinical trial requirements, insurance reimbursement? Right now, this is proof of concept, a real one, but clinical validation doesn't equal deployment. The gap between NEJM publication and bedside use is still measured in years and regulatory friction. If you want to stay ahead of moves like this, where AI enters clinical systems and transforms how specialists work, I build these systems for a living. Join the community. Link in the description. Build the system, automate the rest.